For those watching this video, please be noted that the following sections have been eliminated for patient privacy and time: weight, height, waist circumference, body mass index, Snellen and eye chart, blood pressure, temperature, male breast genitalia, and rectum exam. Thank you.
Hi.
Hi, can you introduce yourself and state your name and date of birth?
Sure. My name is Eric Kotzenbach. I was born November 9th, 1993.
All right, thank you so much. If you'll please take a seat. My name is Susan, and I'm going to be doing your health assessment today. Can you please state where you're from?
I'm from Dayton, Tennessee.
Okay, and your occupation?
I am a QAPI coordinator,
And what is QAPI?
which is quality assurance and performance improvement at nursing homes.
Thank you. We're first going to start out with the general health history. So I'm going to ask you a couple of questions, and I want you to just say yes or no for the record if you have been dealing with them in the past or are currently dealing with them, okay?
Okay.
Have you dealt with ear infections?
No.
Dizzy spells?
No.
Seizures?
No.
Eye diseases?
No.
Chest pain?
No.
Heart trouble?
No.
High blood pressure?
No.
Shortness of breath?
No.
Hepatitis?
No.
Kidney disease?
No.
Hernias?
No.
Any bone, joint, or back disorders or injuries?
No.
Have you had a positive tuberculosis skin test?
I had negative test results for that.
How about chronic colds?
No.
Anemia?
No.
Tumors?
Nope.
What about a family health history? Is there anything your family deals with?
No, I don't think so. The only thing that would come to mind is my grandpa. He had Parkinson's.
Okay.
So that was only one generation we know of that had that.
So it hasn't continued to go through the line so far that you've noticed.
Right, just my grandpa.
Okay. The patient is Caucasian, male in his mid-20s, inadequate to good health and nutritional status. The patient appears his age, is alert and oriented ×4. His posture is adequate. He is sitting and he has no obvious deformities. His mobility and gait was rhythmic and smooth. He has no assistive devices for use. And now we're going to be assessing his range of motion of the joints. So if you could just lift up your shoulders for me.
Okay.
Very good. And drop that. And rotate your cuffs.
That?
Yeah. And rotate your elbows. And then just your wrists. Very good. Okay. The facial expression appears to be symmetric. Mood and affect is appropriate. His speech is articulate, appropriate, and rhythmic in the patient's native language of English. Personal hygiene appears to be within normal expectations. And now we're just going to assess your hearing a little. So the first thing I'm going to do is come over and fold back the pinna. I'm looking for any breaks in the skin, nodules, or lesions, and none appear to be present. And I will do the same on the other side as well. And once again, the skin is free from nodules, lesions, or peeling. Okay, I'm going to go ahead and assess the ear canal now. So this might be a little bit cold.
Okay.
The ear canal is free from obstruction. There is minimal earwax present. There are no nodules or lesions noted. Once again, I will do the other side. The ear canal is also free from obstruction. No nodules or lesions are noted, and there is minimal earwax. Okay, thank you so much. The patient has no use of hearing devices, and his hearing appears to be intact. We're going to do what is called the Weber test now.
Okay.
And for that, I'm going to be taking these prongs, hitting it, and sticking it on the very center of your head. And I need you to tell me whether you hear it equally in one side more than the other or both sides. Okay?
Okay. I hear it equally.
Equally?
I guess, yeah.
Okay. Very good. And now we're going to be doing the Rhine test. So I'm going to be clicking it again, and we're going to place it in front of your ear and and then also behind your ear. And I need you to let me know on which side, either in front or behind, you hear it longer, okay?
Okay. I don't hear it anymore.
Okay.
Okay, I don't hear it anymore.
Okay, we're going to do the other side as well.
Okay, I don't hear it anymore. Okay, I don't hear it anymore.
Okay, very good. Now if you'll just stand for me, please. If I can see your pulse.
Yep.
I'm just going to assess your radial pulse. Okay, the radial pulse is about 62 beats per minute. You can put that down now. Respirations were 18. And now I'm going to go ahead and assess your scalp. So if you could bend forward towards me, please, for a minute. The hair is uniform and evenly distributed with no bald patches, free from nits and dander. The cranium is symmetrical with no indentations. Okay, thank you. You can go ahead and have a seat. If you could raise your eyebrows for me and smile. Very good, and drop. Facial expression appears to be symmetric. For this procedure, since we did not have a patient gown available to us, we are using the dress shirt as an example of the patient gown. So if you could open up the gown for me, please. I'm going to go and just assess your skin trigger to start.
Okay.
So we're just looking to see the elasticity. So I'm just going to be a little pinch. Okay, the skin is elastic. There are no open wounds noted. And if I can see your hands, and turn it over. The nails appear to be convex. They're 160-degree angle. The capillary refill is less than 3, and they are groomed and short. You can go ahead and put that back down. And now I'm just going to go ahead and palpate your temporal artery, okay? And now the temporal mandibular joint. If you can go ahead and open up your mouth for me, please. And close it. And open again. And close. And if you can move your lower jaw forward and back and side to side. And side to side. Very good. Thank you. The temporal artery was elastic and non-tender, and the temporal mandibular joint was free from swelling, tenderness, or crepitation with movement. The mouth opens and closes fully, and the lower jaw moves laterally 1 to 2 centimeters in either direction. I'm going to go ahead and palpate the maxillary sinuses now for a minute. Do you feel any tenderness at all?
No.
Good. There's no swelling that appears to be noted in sinuses. And now we're going to go ahead and inspect the external eye structures. So if you can look straight ahead at me and close your eyes for a second. Okay, and open. The eyelids appear to be symmetric bilaterally. Eyelashes are present uniform with full thickness. The conjunctiva is pink, moist, and intact. And the sclera is white, intact, and free of lesions and nodules. Okay? I'm going to go ahead and inspect the inner workings of the eye now, okay? So if you can just look straight ahead at me, please. I know it's a little bright. Okay, thank you very much. The red eye reflex was present in both eyes, and the ocular fundus vessels emerged from the nasal side of the disc, heading outward. The arteries appeared to be narrower than the veins. Okay. Now we're going to go ahead and inspect your ears again. The outer canthus is aligned with the pinna of the ears bilaterally. The skin is intact. When you move the auricle, and push the tragus for tenderness, it is free from all tenderness. And that is same on both sides. Okay. The tympanic membrane is pearly pink to gray and translucent. It's free from obstruction, it is not inflamed, and it does move with air being blown into it. And that is same bilaterally on both sides, so it is pearly pinkish gray, translucent, and it does move with air. Okay. Now we're going to go ahead and do the voice test. So if you could stand up for me, please.
Okay.
I'm going to have you turn around. Now I'm going to whisper 2 words, and I want you to repeat the second word that I whisper, okay?
Okay. Rewind.
Very good. And you can turn back around now. Now I'm going to be doing an eye test by confrontation. So if you can sit down for me, please. I want you to look directly at my nose. And don't look anywhere else. Just keep your eyes on my nose. And I want you to tell me every time you see movement, okay?
Movement. I see it. I see it. I see it. Yeah, I see it. I see it. I see it. I see it.
Very good. And now I'm going to go ahead and grab my pen light. And this is going to be a little bit bright. What we're looking for very good. Pupils are equal, round, reactive to light, and accommodation. So we were looking for constriction and dilation of the eye, and they both did. Okay, and now we're going to do the H test. And the H test tests your 6 cardinal positions of gaze. So I need you to just follow my finger. Very good. Okay, now I'm going to go ahead and inspect your nose. So the nose appears symmetric from the outside. And I'm going to shine a light up there, so you might want to close your eyes for this. Okay. The nostrils are patent, free from nodules and lesions. The nasal mucosa is moist and pink. And I'm going to just take the speculum and we're going to just test a little bit. Okay. Very good. The septum is not deviated, and the turbinates project into the nasal passageways. Thin, clear secretions are present. Okay, now we're going to go ahead and assess your mouth and throat. So if you could open up your mouth for me, please. And can you lower your tongue a little bit? Very good. The buccal mucosa is moist. Teeth are straight and midline. The palate is pink and moist, and the uvula is midline with no deviation. If you could say ah for me, please.
Ah.
Very good. The uvula is mobile as the patient phonates ah. And now we're going to go ahead and test your gag reflex. If you can open your mouth. Gag reflex is present. If you could please just stick out your tongue for me. Tongue thrust is straight and smooth. Very good. All right, now we're going to go ahead and assess your neck. The neck is midline, free from lumps, tumors, or nodules. The cervical lymph nodes are non-palpable. And the carotid pulse is strong but not bounding. Now I'm going to go ahead and just assess for the presence of bruits. Okay, and on the other side. No bruits are noted. The trachea is midline. Now I'm going to go ahead and test range of motion and your neck strength, okay? So if you could just put your ear to your shoulder for me for a second. Very good. And the other way. Okay, and back and forward. Very good. And now if you could put resistance against my hand. Very good. Same other way. Okay, lean back. Very good. And forward. Very good. Okay, and if you could just do a shoulder shrug with both together. All right. And if you can turn around for me, please. I'm just going to go ahead and palpate the thyroid gland. Okay. Do you feel any tenderness, pressure?
No.
Very good. Okay, and now I'm just going to go ahead and have you take off the patient gown. Around the back, you can go ahead and just put it across your front instead for now for privacy. Okay, and now we're just going to assess the shoulders and muscles of the upper and lower back. So the shoulders and muscles appear symmetric and free from lumps. Do you feel any tenderness at all?
No.
No tenderness is noted. Okay, and if you can turn around for me, please, and face me. Very good. You can just do some deep breaths. Okay, and release. No tactile fremitus is noted. And once again, breathe in. And release. And chest expansion is symmetrical. Okay. I'm just going to go ahead, if you could turn around one more time, and percuss your lung fields. So you might feel a little pressure, but you should feel no pain. If you do, let me know, okay? Okay. I'm just going to make a mark. Okay, and if you can turn around and face me, I'm going to percuss your anterior lung fields. So once again, any pressure, pain, let me know. You should feel a little bit of pressure, but no pain. Very good. Okay, and now I'm going to go ahead and auscultate your breath sounds. So just continue to breathe normally for me, okay?
Okay.
Bronchial breath sounds are present over the trachea. Breathe in again. Bronchovesicular breath sounds are present between the scapula and below the clavicles. And vesicular breath sounds are present over the lower lung fields. If you could please just lean forward briefly and exhale. And by doing this, I'm auscultating the cardiac base for any murmurs. None appear to be present. Okay, very good. You can go ahead and put on your patient gown again. Now we're just going to test the range of motion and muscle strength of your hands.
Okay.
You could grab onto my fingers and squeeze bilaterally or together. Very good. Muscle strength is equal bilaterally. Okay, we're just going to test range of motion now of your arms. So you could lift both arms together. Okay, and do circles. Okay, and stop. And now bring them back in and elbows and circles. Very good. And then wrists and stop. Very good. Okay, I'm just going to go ahead and palpate your epitrochlear nose. Okay, and on this side as well. Do you have any tenderness at all?
No.
No swelling appears to be noted, and the epitrochlear nodes are non-palpable. Okay, if you'll just lay down, please, for me. Very good. The abdomen is flat and symmetric with no pulsations present. The umbilicus delves in, and the skin is within normal limits of color for a patient's ethnicity. Now I'm just going to go ahead and assess your bowel sounds. Bowel sounds are active, and vascular sounds are not present over the aorta, nor are they present over the renal arteries. Now I'm just going to go ahead and percuss your quadrants. Let me know if you feel any pain, okay? Any pain, tenderness?
No.
Very good. And we're going to go ahead and percuss the liver, which is on the right side. So if you could breathe out for me and hold your breath. Any pain and tenderness?
No.
Okay, and spleen.
No.
Very good. Now we're going to go ahead and do some palpation. So you might feel a little bit of pressure, but once again, you shouldn't feel any pain. If you do, tell me immediately, okay?
Okay.
So we're going to start with some light palpation of the quadrants. Any pain, tenderness?
No.
Okay. And we're going to go a little bit deeper. Anything?
No.
Very good. Now, if you can breathe out and hold your breath. I'm going to palpate for the liver. Any pain?
No.
Okay. And for the spleen.
No.
Very good. Spleen and kidneys were non-palpable. And now we're going to go ahead and take a look at the lower extremities. Okay, in this patient's case, the lower extremities are symmetrical bilaterally with even hair distribution and skin tone within normal limits, free from any wounds, nodules, or lesions. I'm going to go ahead now and palpate your popliteal pulses. Okay. And your post-tibial pulses. If you can just lift your leg for me so we can be seen on the screen. Very good. And the other side as well. Okay. And we're also going to be palpating your pedal pulse as well. So once again, very good. And once more. Very good. Okay. And now we're going to go ahead and palpate for temperature. The legs are cool to the touch and free from pretibial edema. I'm going to separate his toes and inspect. The toes are uniform bilaterally. There's no skin issues or lesions present in between them. We're going to go ahead and test range of motion and muscle strength. So to start, I'm going to have you lift up your legs at the hips, back towards you. Very good. And down, and back up, and down. And this time just pulling your knees to your chest, and down. Very good. If you'll sit up now, and please dangle your feet off the edge. Okay. Now I'm going to go ahead and test sensation for neurological issues. I want you to let me know every time that you feel the sensation, okay?
Okay.
Close your eyes.
Okay. Yes. 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 Yep. 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 Yep.
Very good. You can open up your eyes. Okay. Now we're going to test your position sense of finger. So I'm going to touch a portion of your body. Your eyes are going to remain closed, and I need you to touch where I've touched, okay?
Okay.
Very good. Very good. Very good. Yes. And one more. Very good. Thank you. Okay. And now we're going to test your cerebellar function of your upper extremities using the finger to nose test or rapid alternating movements test. So if you could bring your finger and touch your nose with your eyes closed as fast as you could.
Okay.
That's good. Thank you. Now we're going to test the cerebellar function of your lower extremities. So what I want you to do, if you could lay down flat.
Okay.
So you can be seen by the camera. Okay? And I want you to take your heel and run it down the length and up the length of your shin.
Okay.
As smooth as you can. Very good. And the other leg. Very good. You can stop that. Okay. And now I'm going to go ahead and have you sit up. We're going to elicit some deep tendon reflexes.
Okay.
So if you could face me. The first one we're going to do is your biceps. So if you could hold your arm like this for me. So I'm just going to hit right there. Very good. And on the other side. Very good. And once again, if you can hold your arm like this, we're going to assess your tricep as well. Okay, and your other side. And just kind of relax it. I'll hold it up for you. Very good. The next deep tendon reflex we will be assessing is the brachioradialis. So I'll need to see your wrist. Very good. The other side. Very good. And if you can lift up your leg a little bit so it hangs more freely. More like down here. So. Very good. And we're just going to assess your patellar. Okay, and the other side. Very good. You can put that down. And now I'm going to assess your Achilles. So if you want to lay down so you can be seen by the camera once more.
That way, face down?
No, on your back, please. Thank you. I'm just going to go ahead and lift up your leg from the other side so it can be seen. And we're going to assess your Achilles tendon. Okay? So what we're looking for when assessing the Achilles tendon reflex is dorsiflexion of the foot. So it goes upwards. Okay? You can go ahead and sit up. If if you want to turn this way for me. I'm just going to be inspecting the lower legs for any signs of varicose veins. And in this particular patient, the legs are free from any signs of varicose veins. Okay, if I could have you stand up for me, please. We're going to move this backwards, out of the way a little bit. And if you would be willing to just walk across the room in your normal gait for me.
Okay.
To me. Okay, and back. And now if you can walk towards me in a heel-to-toe fashion. One foot in front of the other. Very good. And stop. And do that again on the back way. Heel-to-toe. Okay? And you're welcome to turn around. And I want you to walk on your tippy toes towards me. Okay, good. Down. Now, if you'll just stand with your feet next to each other, uniform, and close your eyes, I'm assessing for Romberg's sign. So I'm looking for any excessive sway. Okay, and you are good. That's enough. If you can please hold the edge of the stool here, or one of the chair arms, if that works easier for you. Okay, and I want you to do a couple of knee dips. Just gentle, easy. So, very good. And on the other side as well, a knee dip. Very good. Okay, if you'll just stand facing away from me, please. Okay, I'm going to have you bend over to touch your toes. I'm checking for spinal alignment. Okay, and you can stand up once more. And now, if you'll just face me, stay standing. I'm going to just reach out and stabilize your pelvis, okay? And if you could hyperextend, like lean backwards for me.
Okay.
And then forwards.
Okay.
Okay. And forwards. Very good. And then side to side. Okay. Very good. And if you could twist your abdomen from side to side. All right. And once more. Very good. All right. Thank you so much for being a part of our physical assessment today. I do appreciate you being our patient.
Thank you.
Thank you.